WellSky is a healthcare technology company that offers software solutions, analytics, and services to help providers across the care continuum, acute, post-acute, community-based providers, optimize outcomes both for the provider and the patients that they serve. CarePort is the care transitions piece of WellSky, and what that means is we are the technology solution that bridges acute health systems with post-acute and community providers. Over 1,000 hospitals and health systems with over 100,000 post-acute care providers.
So I'm John Kunysz, President and CEO of Intrepid. Intrepid's the 12th largest home health care and hospice company in the United States. We're in 17 states, about 64 locations, about 14 hospice locations throughout the country.
Intrepid is a longtime client of WellSky. Intrepid uses the WellSky software solutions from home health and their hospice business. They use our analytics solutions. And from the CarePort perspective, they're also a CarePort Care Transitions client. We started to work with Intrepid many years ago when we partnered with them to help them better receive referrals and communicate with their hospital partners as patients are transitioning out of the hospital and into the home and hospice community lines of business. And over time, that relationship has just grown, which is one of the most exciting parts of working with a client like Intrepid. It's been a great relationship and one that has matured and grown over time, which is exactly what we like to see with all of our clients.
It's interesting, when we look at what defines success for Intrepid, it really is a fabulous clinical and patient experience. And that's not just for patients, but for our clinicians. Because, a lot of people talk about the patient comes first. Your clinicians have to come first. And if you're investing in clinicians with the right kind of technology, the right kind of resources, the right kind of care guidelines, they're going to provide excellent care. And that's going to result in a fabulous patient experience. And when we look at how WellSky and CarePort come into play, one of the things we love about it is their commitment to continuing to evolve.
As the founder of CarePort, client success is deeply personal for me. And one of the reasons why I love working with clients and our whole organization likes working with clients is because there's such diversity in workflows and the challenges that our clients are facing and where they are along the continuum of fee-for-service and the transition to value-based payment.
When you look at connecting into a post-acute care strategy with patients and that continuum of care, it's really important that you look at, and the way in which we look at the way CarePort and WellSky helps us optimize that is it lets us plug into that continuum at any point along that path. Because a lot of folks kind of view themselves very monodimensionally as, well, I provide hospice, or I provide home health care, or I provide non-skilled. And what really happens is you have patients that migrate between a lot of the aspects of the post-acute care continuum and sometimes advance and get better. We've actually had patients come off of hospice, go back to home health, and then eventually go back to hospice, or they go into a palliative program. So one of the things we like is the ability for us to work with WellSky and CarePort to take advantage of that continuum of care and the way in which they built their systems around that, and linking the referral partners in as they come in from the various sources, whether it's long-term post-acute, SNFs, acute care environments, general community-based physicians that are working with them. It really lets us pull them in as we need to and then plug them into our continuum of care model.
I'm really excited about care transitions. Patients are living longer, they have more needs, they're more complex as they are coming out of the hospital. They have more care transitions because they're seeing home health providers, DME providers, skilled nursing facilities.
One of the things that when we were looking at selecting a different partner on a clinical health record, electronic health record system in the post-acute environment is looking at somebody that understands it's a continuum of care. So you go from the complete non-skilled side through the home health care side and the skilled side of services, as well as into the palliative and then the hospice services care. So that was something that we didn't want to have just a bunch of individual one-off solutions, and really WellSky and the CarePort way in which they've approached the marketplace for us was really important. They saw it as a comprehensive solution to this continuum of care that we see it. It's a continuum of care in post-acute, not just an isolated care model.
I think one of the biggest challenges surrounding care transitions is the fragmentation and silos that exist across the provider ecosystem. Traditionally, for example, acute health systems and post-acute and community providers have been quite disconnected. What we're seeing now is a need more so than ever to build those bridges across the care continuum, to connect acute and post-acute care providers in the ways that they communicate, in the ways that they share data, in the ways that they collaborate to care for patients. At CarePort, that's one of the things that makes me really excited to be here and to continue to lead this company into the future, is the ability for us to play a key role in making those connections and building the bridges across the acute and post-acute care continuum.